You always have to be cautious recommending surgery as the answer. The risks become greater. The risks are greater with the lower eyelid than the upper eyelid.
We're seeing in the States as well, patients who are on GLP-1s losing a significant amount of weight.
Laser is a great solution for the lower eyelids, and we should never overlook that.
If there's bulging deep fat or festoons, those are really difficult to treat non-surgically.
When you go from non-surgical treatment, this is perhaps the next step into a surgical treatment.
What should we expect from a timeline of sustainability from these surgeries?
When people are using filler and if you try and iron out every crease.
Is there a way to reverse the fat transfer?
We've non-surgical things that look to melt fat, and some of them can be effective.
Facelifts can only last for 10 years, or in another 10 years, you'll have to get another blepharoplasty. Is there truth to that, or is it really just individual aging?
I don't think every 10 years. I think as a patient, I did a revision on 10 years down the line.
Hi, everyone. Welcome back to Give Good Face, the podcast where we explore all things beauty, health, science, and of course, aesthetics. Today, I'm very fortunate to have someone across the pond, Dr. Jonathan Dunne, a consultant plastic surgeon in London. He is the founder of Montrose London, a private aesthetic clinic, but also is the lead skin cancer surgeon at Imperial College of London in the NHS. So I'm so grateful and honored to welcome Dr. Dunne. Thank you for being here.
Thank you for having me. Thank you.
So I actually was just in London for a friend's birthday, and I had a lot of great conversations with people. And, we were just talking about aesthetics and sort of the aesthetic trends that were happening in London, which is an amazing city in and of itself. But can you tell me, as a plastic surgeon, what have you been seeing most now in London?
I think the big change in the past even few months is similar to the States, in that there are so many people on weight loss treatments and medication. And that obviously is taking effect. It's had really great results for people. But we do see a lot of people sort of surprised at how their appearance changes. So particularly facially, but also body. So excess skin, the loss of fat, which of course makes us appear more youthful in many ways. But we are seeing people who want to adjust how they look and get that more youthful and energized appearance, if you like. So that's a common thing.
Yeah, same here. We've been seeing so many patients on GLP-1s, and, it depends where you see them in their progress, right? If you see them at the beginning or in the middle of their journey, or, towards the end when they've lost a significant amount of weight. As a plastic surgeon, you can intervene surgically, you can intervene non-surgically. How do you counsel these patients? Do you tell them to come in early, or do you tell them to come in after they're done with their weight loss?
The easiest way and the most predictable way is to know when they've finished their weight loss journey and it's been stable for a while. So, this is how it's going to be, because abdominoplasty, a tummy tuck, is probably the easiest one to think about. When you're still losing the weight, you do the surgery, it's a great result, but then you lose more and you have excess skin, you're more deflated, you've lost more weight. So it's tricky. It's tricky.
Yeah, that's something that we're seeing in the States as well. Patients who are on GLP-1s losing a significant amount of weight. And I do agree with you that for surgical intervention, we really should be waiting to the end. But a lot of patients come in and, talk about their facial aging, which can be really significant. And, they point to celebrities who also have been on GLP-1s who look sort of amazing the whole way through. And they want to know, like, are they doing things to their face, throughout the journey?
So I think you're right. I think if you're going for surgery, that's sort of your one-stop solution. But actually, there are non-surgical things you can do on the journey for sure. And it's really thinking about what the changes are. So excess skin loses its elasticity. It's not as tight. You're losing volume as well. So any non-surgical treatments that address those things, I think, are worth pursuing. For the skin, that's laser. For sure, it's perhaps energy-based devices like Morpheus 8 is the big brand name, radiofrequency and microneedling. And then, of course, volume. Volume you can certainly replace with hyaluronic acid fillers. They last for a period. If you are wanting surgery at a later date, it does make it more difficult. I think that's a caveat just to be aware of. But those things, addressing volume and skin elasticity, are the things you can do to look great as you go along. And I think there's no harm at all in doing that as you go and keeping surgery in the back of your mind, should it be something you wish to pursue at the end of this weight loss journey.
Yeah, no, I think we're all evolving the techniques, that we're using to help these people along their journey. But it's really interesting to see. And, at your clinic, the Montrose Clinic, it's beautiful. It's a beautiful aesthetic clinic. What trends are you seeing, or what are people coming in for? I know you and I discussed a little briefly like that you're seeing more blepharoplasty actually come in as a surgical treatment.
We do, and I think it's seen as almost the entry surgical treatment, which is perhaps wrong, but because it can often be done local anesthetic, day case, you don't necessarily have to be asleep for it. And it's so striking and makes such a difference. The eyes are the central point of the face, the window to the face, really. And we see so many people knowing that when you go from non-surgical treatment, this is perhaps the next step into a surgical treatment. It's not a facelift, it's not loads of downtime. It's something which you can go ahead with and have quite a quick recovery, really, 1 to 2 weeks maybe, and you're back doing things that work, back to social events, sometimes a bit longer for bigger events. But that's what we see a lot of, actually, is people coming for these shorter procedures to make a striking difference.
Yeah, I think blepharoplasties can have such an impactful outcome for patients, both upper and lower. And when someone comes to you with issues around their, infraorbital hollows or sagging skin on the lid, how do you counsel them? Like, should you do a blepharoplasty at the beginning, or should you try, hyaluronic acid filler in the infraorbital tear troughs? How do you feel about that approach?
I think you always have to be cautious recommending surgery as the answer, because the risks become greater. The risks are greater with the lower eyelid than the upper eyelid. So really, I keep that at the back of my mind. Think of what the patient may want. Is it non-surgical? I mean, surgery is really the tip of the iceberg. Most people want non-surgical, but it's just assessing what the need is. Is it skin laxity or too much skin? Is it bulging of the deeper fat? Is it actually volume loss? I mean, I think the indications for hyaluronic acid filler are quite small, probably for the lower eyelid, but if it's a small area of volume loss, you haven't got big bags, then actually filler can work very well. And I think that's something to be considered in the right hands, because of course it has complications in that area. But they're the people who should have filler. Of course, I'm sure you did as well. Laser is a great solution for the lower eyelids, and we should never overlook that. In terms of skin, it's the number one. It's not a blepharoplasty, it's laser, in my opinion. So I think it really depends what people are coming with. Filler can work well for a small group of patients. Often it's a multitude of things. It's laser, could be filler, or it could be surgery to address the bulging fat pads, and also a little bit of that volume change as you go from the lower eyelid to the cheek.
Yeah, no, I think you hit the nail on the head. These combination treatments can really be super helpful, whether it's surgery plus laser or some sort of non-invasive skin tightening. They really can help augment the area. But like you said, if there's bulging deep fat or festoons, those are really difficult to treat non-surgically. And sometimes surgery is the answer. And it's not just camouflaging with filler, in that area. I always caution people who have really protruding orbital fat, masking it with filler might only be like a very short-term temporary solution
Yeah.
that in the long run
Yeah,
may
I
not
would
look great.
completely agree.
Yeah.
No, I was going to say, perhaps, I mean, you can keep it there for a while, I agree, but it's not probably the long-term solution. But some people are for sure happy with that, and I wouldn't overlook that. But you're right; those are problems that really are surgical, I think.
What about the idea of just changing the eye shape? I feel like we're seeing that a lot in pop culture, really, turning up the cantle tilt, or, doing a little sort of brow lift with a cantopexy. How do you feel about that aesthetic? Is that just a trend that we're seeing, or do you think that that's around to stay? It's almost, changing completely the eye shape.
Yeah, I agree. I mean, it's not something we see lots of in London, I would say. I think it's different countries, different cultures. It's more common. But you're right. It can be a bit of a one-way change of anatomy and change of shape. It wouldn't be something I advocate. We just don't see that many people who are requesting it, to be honest. I think brow change, yes, we do definitely see that, and wanting a bit of brow elevation, that can be done as a quick procedure as well, and it can work well. But changing to the angle of the eye, and that's more complicated for sure, slightly more prone to problems, and just something we don't see as much of. But I think you have to caution someone before going ahead with that. That definitely takes on increased risk and perhaps increased dissatisfaction. So yeah, you will get lots of people asking for it. We don't see as many here for whatever reason.
Yeah. I think people are seeing it more and more on, social media. In other countries, I know, I was speaking with an Asian plastic surgeon and they do a lot more of that in Asia. We see it, in LA. I think we actually see it more,
Mhm.
even though it's still in the same
Yeah,
country. It's sometimes a world
yeah,
apart
yeah,
from the East and West Coast.
yeah.
But yeah, it's really interesting surgically what you can do. And even these minute, like millimeter changes can have such a dramatic impact on someone's overall facial aesthetic.
Yeah, I completely agree. And with eyelids and the brow, it really is millimeters. And I mean, that's what you're doing when you're looking for more sort of fox eye appearance. It's really subtle in terms of the surgery, but actually, of course, it makes a striking difference. And it is fascinating to see different places. In London is so international; it's inevitable. I think we'll get more of it. We just perhaps haven't quite seen that yet.
A great discussion for our listeners is when they're choosing a plastic surgeon, because very much it's an interview in some respects, it's a consultation. Are there questions that you should be asking your surgeon, like when you're going for a consult about aesthetics?
I think for sure. I mean, in the US, similar to here, you want to know they're board certified. So, what's their training? And I think we have far more variation in this country for a number of reasons. So, you want to know their background. You want to know, are they a specialist in the type of surgery you want? I mean, are they doing lots of it? I think is key. If you having someone who's doing facial surgery, you want to know they're doing lots of it. And I think it's also pretty key to know it's someone you can get on with and relate to, because it definitely is a partnership. Things can go extremely well. Sometimes things are a bit slower in terms of healing, etc. And you need to know that person's going to be there and be available. I mean, we see quite a lot of people traveling into London for surgery. We see a lot of people traveling out to other places in Europe and beyond as well. And you obviously lose that connection if you're not in the same place, but you just need to know that person's accessible and you can speak easily like this remotely. But I think knowing that they're accessible and you're going to get on with them is pretty key, as well as, of course, their surgical background. I mean, that's the basics of it, really.
That's a great point. Accessibility, being able to, speak with them openly and candidly, because I think one thing patients don't fully understand is that healing is a process, right? And, things can sometimes heal just beautifully and wonderfully in a linear process. And sometimes it can actually take time. And there's roadblocks to that, infection or just delayed wound healing. And
Mhm.
that's not for any specific necessary reason, whether it's operator dependent or just, internal body healing. But it's a process. So like I always want people to know that.
I think so. I mean, I feel that we do the surgery or you're doing whatever, laser and different treatments that can be really quite aggressive, but you need to know week by week things change, and you spend your time wishing you had a magic wand just to get that time moving for people. But you do have to, some people breeze through it, even if they have problems, but you just need to know that you've got that support which is available and to get you through the journey which it takes. And things do take time, unfortunately. So yeah, accessibility and having someone that you can relate to, I think, is really important.
Surgeries that you love to do, particularly, like what's your favorite?
Favorite is blepharoplasty. I think upper and lower blepharoplasty have their own merits, their own niche elements. So for sure that, and most of my surgery, particularly in the reconstructive side, is facial as well for cancer work, skin or head and neck cancer. So I think that all lends into different skills coming into different outcomes. It depends. Aesthetics and reconstructive have their different sort of components that make them more difficult in some ways. But yeah, eyelid surgery I think is so great because it's niche. It's very sort of fine movements to make subtle differences really, but a great difference to the patient. So definitely upper and lower blepharoplasty.
One thing a lot of listeners have been asking me, and I'm going to ask you now because you're the expert, is what should we expect from a timeline of sustainability from these surgeries? Like, many people say after 10 years, you need to change your breast implants, or after, facelifts can only last for 10 years, or in another 10 years, you'll have to get another blepharoplasty. Is there truth to that, or is it really just individual aging?
I think it's individual aging. As 10 years is the benchmark everyone uses. And I think it's probably come from breast implants and of course, you look at photographs 10 years ago and 10 years further on, things change. But I don't think every 10 years. I think the patient I did a revision on 10 years down the line, she was desperate for it. But of course, I don't think she was back to where she was 10 years ago before the first operation. So I would say it can last longer. I think it depends. The more invasive and aggressive the surgery, if you're doing a more aggressive facelift, such as a deep plane, it will last longer. That's for sure. But you take on other things, such as perhaps additional risks and recovery, and you balance that out in terms of how long it will last, and actually is the result going to be better. So I think you can last longer than 10 years, and of course the non-surgical might come in to support any results and extend how long they last, because the skin is the area that can be relatively unforgiving, and if you can keep with regular laser, perhaps microneedling, all those things can keep a healthy skin and keep things younger for longer.
I love that point. Even if you do get a facelift, it's really regular maintenance of the skin that is also going to help keep that shelf life, I think, as well. Of course, diet and exercise as well, a healthy lifestyle. Surgery can't overcome cigarette smoking and all that.
Yeah. Well, surgery rarely addresses the skin, ironically. It definitely doesn't make it healthier. So that's where all the other elements come in. So yeah, surgery addresses everything but the skin, really.
Because you have such a great expertise in surgical and non-surgical treatments for aesthetics, can we play a little bit of a game where I say a procedure and you tell me how much it's worth? Like, is it worth it on a 10 out of 10 or 1 out of 10? Let's just start with polynucleotides. We don't have them in the States. They're not FDA approved here. But in London, I see a lot of people doing them.
6 out of 10.
6 out of 10. Okay.
And my reason behind the numbers, so when we talk about who should have filler, I think it works well for younger people who don't have sort of pronounced changes with eye bags or tear trough deformity. I think when it's really subtle, I think it works very well and people love it. So you're looking at people who are really probably in their 30s, I think, but have a little bit of change and don't really want to wait just to leave things. And you do get changes which improve with time. You definitely get better skin quality. So that's why 6 of it. I think it's a smaller group, but it works well in them.
What about barb suture threads and the thread lifting technique?
I'm going to say 1 out of 10.
Yeah. I'm glad you're honest. Yeah. They must be a nightmare for you surgically.
They are. I mean, it makes everything really quite scarred, stuck down. We've had people come, we don't do them at our clinic, but we've had people come where they're extruding through the cheek and then you're leaving a wound there.
Wow.
I think on the day, I think you make an improvement. I think that a couple of months maybe still, but I think they just don't last, because I think the people who really benefit have quite a heavy face and then it just doesn't last. But of course, I'm sure other parts of the world, they are extremely common and people use lots of different types of threads. So other places, but it's not a big thing in the UK, I would say, and I think they just don't last really.
Yeah, I do caution people as well. Like immediately right after, they may look great, but like, do they actually last? And are you setting yourself up for more fibrosis and such later on? Yeah. I agree. What about RF microneedling?
So I'd say 8. I think it does work well. I think again, you pick the people who will benefit from it, and I think it's people around the neck. I think it can work really well when you've got sort of excess skin, usually in people, slimmer people, so perhaps people who've lost weight, as we were talking about. I think just that energy, the tightening, there is a bit of downtime. You might say similar to sort of more ablative lasers. It can be like that, but I think you can get really good results after usually 2 or 3 treatments.
One of my favorite things is the fractional CO2 laser. How do you all feel about that? Do you use it during a facelift as well?
In the main, have separated out, and we have an erbium laser, but I think you can and should combine them if it's the right patient for it. But I mean, a great treatment for sure. It makes a huge difference in terms of skin quality, in terms of appearance. Yeah, I would definitely rate CO2 laser highly. That'd be a 9.
Awesome. Something, very interesting, and I would love your take on it because you are a plastic surgeon. Fat transfers versus hyaluronic acid fillers or biostimulatory fillers.
I think it very much depends. Here largely use HA fillers rather than any which are sort of longer lasting, to be honest. I think in the first instance, it's probably worth people having HA fillers because in the main, they don't last unless you have some problems. I mean, if you're doing a lower lid blepharoplasty, I think it's fat transfer to augment and maintain that. But it very much depends on the problem. I think most people have filler, and that's fine. I think people are being far more selective about it now than they used to be. It's not necessarily people having huge lips or very much augmented appearances with filler. But in surgically, I think if you're going to do it with a facelift or around the eyes, then it's fat transfer rather than HA filler because it just won't last. And of course, there's complications associated with doing it repeatedly.
Yeah. Interesting. Yeah, I know some of my patients will, and people will ask me, should I just do a fat transfer instead of wasting time with fillers? And I say
Yeah,
it's of course it's personal, but HA fillers do have a very nice effect on the
yeah,
subcutaneous portion, the deeper portion, but also the skin as well. And it can really help you understand what the face can look like, whereas fat transfers are definitely more obviously permanent and from my understanding can be a little precarious in how much they take.
yeah, for sure. And I think we do it quite a lot for reconstructive anesthetic purposes. And often you find people love it the first day, but of course you've got swelling, you've got a bit of bruising. Probably about 2/3 will stay over time. So you are committing yourself to potentially a second round of fat transfer, so another operation. It's not quite like filler in that sense, but works well. But I think you're right. I think there are other advantages of filler that we really need to bear in mind, and it's the best place to start off with filler.
And one thing that people have been asking is, we've seen a lot of celebrities sometimes, sort of come out of hiding and their face looks
Yeah.
really swollen and really puffy. And some people speculate that it's sort of, too much fat in a fat transfer. Does that happen? Can that
Yeah.
happen?
I sort of relate it to when people are using filler and if you try and iron out every crease in someone who's older, it's a terrible idea. It has to be well placed and it has to be in the right places. And I think people do put too much in. And then when you have sharp contrast, say from the cheekbone, and then they've maybe had the buccal fat removed, it just doesn't look how the anatomy is meant to be. And I think you can put too much in, perhaps knowing that not all of it's going to survive, or knowing there'll be swelling and bruising, and it's the wrong thing to do. You're better to commit to a second round of fat transfer at a later time than really go for it, I think.
So the key in that is not go for a home run necessarily the first time around.
Yeah, and you pack it in. It's almost like snow. It'll just melt away, and you have to sort of layer it so that the blood vessels can grow in between the fat that you've put in, and it survives really. So the more you put in, the less will survive, ironically. So don't go for the home run first. Just really go easy on the first round.
That's a good point. Is there a way to reverse the fat transfer? People have asked about that as well. Or do you just have to let it run its course?
You let it run its course, really. I mean, of course, there are different things. We've non-surgical things that look to sort of melt fat, and some of them can be effective. But the problem is sometimes you get fat necrosis, and then it stays as a hard lump, and then you're just left with a different problem, really. So I think it's always better to put less in to begin with, and then avoid that problem completely, because there is no easy way just to extract it. You really have to just wait and see what happens.
Amazing. These are great to thank you because these procedures have a lot of nuance and that's I think what you also said is you really need to go to someone who's board certified who does these procedures in and out. There's a lot of nuance and a lot of tweaking that can be done and a lot of understanding around this procedure that the patient may not fully get because, the surgeon's thinking about it but they're not.
Yeah, exactly. Exactly. So I think you really have to know what the course is going to be. I think it's more what's going to happen afterwards so that you can feel confident that the person knows how to manage it and ease you through that path and the journey, really, that's the post-operative care, and just make things easier afterwards, because that's often the more worrying time or the concerning time for the patient. And you just want to make that as easy as possible for them.
And is there ever a time that you meet someone and their aesthetic really doesn't jive with your aesthetic?
Occasionally, I think you sort of get their understanding of what they want. And typically, I think of our clinic, and it's not just me here, but those people don't tend to come, if I'm honest. They sort of know what to expect when they come through the door. So we just don't see them. But I think if you do, you get an understanding of what they want. And all of this is about meeting in the middle and knowing what the patient wants and what you can deliver. And I think if they're not the same, then you both get a feeling that maybe this isn't going to be the right path forward. And you can often direct them to other people, or they'll know of other people that they've read about or heard about. It's all about opinions, really. And it's probably that key thing about knowing that you can get on and take things forward together, really, in terms of managing what you expect as the outcome and how things are going to all settle with time. So we don't see many, but when you do, it's really about just steering them towards somewhere or someone they may want to see. And probably that one is people being very cautious with particularly younger patients to not go for surgery or try and steer them away from having too many treatments which just aren't indicated. Unfortunately, if you ask enough people, someone will do it, but I think some of my most loyal patients are the ones you give quite honest advice to in the first instance, and that really gains their trust, I would say.
Yeah, I agree, especially now with the rise of plastic surgery or cosmetic surgery, non-surgical and surgical in the younger population too. I feel that we're seeing younger and younger patients ask about these procedures or really, go for them. And do we have a duty as a society, as in medicine, to help, sort of navigate that? I mean, should young people be getting so much work done at such a young age?
You're right. I think most of us doing more facial things. I see less of that, but I think there's obviously a lot in the media and there's a lot in social media about all of these things, and you find out about it on a daily basis. And I think there is a duty to make sure people aren't having things they feel pressured to do or haven't really thought through, and try and steer people away from that slightly, because there can be people who are more susceptible, more vulnerable to it. And I think you don't want to encourage those people to have things done that perhaps just aren't needed or they feel pressured to have. So yeah, I think that is honest opinions are key, and just get them to think twice about what they may want, which may not really be the best thing for them.
Yeah, for sure. I never want anyone to rush into anything. So that's great. I mean, you have Montrose, London, which is an amazing, beautiful aesthetic clinic. And one thing I love about you is that you do aesthetics, but you also do skin cancer surgery. So you have both the medical, reconstructive, and aesthetic side. And I
Yeah.
think that's really important for a surgeon who can understand both the functional and medical outcomes of surgery, as well as the aesthetic, and appreciate the aesthetic and beauty outcomes as well.
No, I was going to say, I think it's really a spectrum, and one does feed into the other. The techniques are similar. You often do the reconstructive parts in your training before the aesthetic parts, but one does feed into the other, and it gives you, I guess, a broader view on how to solve problems, which is a lot of what this is about, whether it's aesthetic or reconstructive. And our specialty is very technique based, and I think it helps really in terms of getting the best outcomes for patients, is how I would see it.
Yeah, I think one thing we love is how to solve problems both creatively and functionally, which is super important as well. And on the skin cancer front, are you seeing more and more skin cancer? In America, we call it an epidemic.
Yeah, it's the same here. It's the same. And London is quite international. So we have people from who lived in sort of places with far more sun exposure than the UK. But even if people haven't left the UK, we have sort of high rates of skin cancer. It's only increasing in all age groups. And people still are not that sun aware. You can find sunbed shops, tanning shops in most places. You get a hot day, and it's hot at the moment here, but you get people are outside, you see burnt people. People just aren't that sun aware compared to hotter places such as parts of the US and Australia we see quite a few from. But it's increasing. I don't think there's any great sign that that's going to change in terms of how people's behavior and habits are. So it's definitely a busy area in the NHS and also in our private system here.
Yeah, I when I go abroad to Europe, at the beach, I'll always see like a group of British lads who are just like frying in the sun.
Yeah,
And
yeah,
I cringe, and being fair skinned and just seeing them burn is just, I'm just like, oh, it's hard. I
I
think
know,
Australia does a
I know.
great job of like teaching their young children to like really be sun smart and sun protective. It's that message hasn't gotten out across the whole world though.
For sure, it hasn't. And perhaps when you go on holiday, it's a little less than when I think of being a child, but it's still nowhere near where it should be. And some people are very aware of wearing high factor SPF daily and being really cautious. Obviously, it helps aging, which is obviously a good selling point. But it also is about the sort of sun exposure and skin cancer. But for large parts of the population, people are still not very sun aware. They burn, and the risk is high. And obviously, this country is getting warmer. We see hotter weather than we used to. So I think it's only going to increase. And public health campaigns to change that haven't quite got there, I would say.
Yeah, I was just in London and it wasn't cloudy at all and it wasn't raining. It was beautiful and sunny and the sun was strong.
A
So,
rare occasion. Yeah,
yeah.
yeah,
I don't know, it seemed amazing to me.
yeah. Yeah,
Very
no, it's a
cool.
particularly hot patch at the moment, so it's yeah, it's you'll see more of it than ever at the moment. It's just people are out in it and too much sun exposure. So yeah, an increasing problem that we're trying to manage, but with plenty more to do.
Lastly, a question that I had for you because I think it's such a beautifully done space is the Montrose Clinic. What was your inspiration for that? How did you come up with such a unique place?
So interesting. The three of us who have set up the clinic knew that we wanted somewhere which was slightly tucked away, so it was discreet. What we wanted was an attractive building, so we have an old period building, and it to be somewhere that people wanted to go to and spend time in. And our waiting area is on the more maximalist side and brighter colors and aesthetic, and then obviously it's more clinical once you go beyond that. So the idea was just to be a place that people wanted to go to and felt comfortable. And we've had a range of patients. They might be aesthetic, they might be even more medical from a skin side, who certainly find it somewhere which is comforting, you're listened to, and you can find it a trusting place to go to when we're talking about those things before. So yeah, somewhere attractive but discreet was definitely the aim, and we think we've achieved that. It's certainly slightly different to other places.
Yeah, it's unique, it's beautiful. It doesn't feel, like you're going to get a surgical procedure or a medical procedure. So already the bar is, set high in expectation, but also it's calming and very a very nice place to be.
I think that's right. I mean, we've all sat in very sterile waiting rooms, and it sort of builds the anxiety no matter what you're having. So I think having that more relaxing side, be it summer, winter with a fire on, it definitely helps, and it's certainly something we've had good feedback on from patients. Is that it's a nice place to be, and that's what our ultimate aim was.
Yeah, it could be one of London's main tourist attractions soon for medical tourism.
Yeah,
Which there is a lot of, we even see people here leave the country to go to other countries because things may be cheaper or, and less expensive. I don't think that's London by any chance. But, I do, like you said, you tell patients they really need to understand that these are real surgical procedures. They have real, complications. Hopefully not, but it can happen. So you really want to be with someone who knows what they're doing, board certified, and will be with you throughout the whole experience.
yeah, for sure, for sure.
Amazing. Well, thank you so much for your time, Dr. Dunne. This has been eye-opening, to say the least.
Yeah, thank you very much for having me. It's very
Yeah.
kind of you to invite me on.
Thanks so much for listening to this episode of Give Good Face. I'm so grateful for all your support throughout the launch of this podcast show. Please subscribe, leave us a review, send us a DM, follow along wherever you listen to your podcasts.